Good afternoon, everyone. Welcome to Power Corridors. Story of Change. Dr. Ranjan Modi. Dr. Ranjan Modi is a renowned cardiologist, a senior consultant, interventional cardiologist with expertise in structural heart disease. Dr. Modi works out of the prestigious Indraprastha Apollo Hospital. He has 13 years of experience in the medical fields, and that has won him high honors such as Best Researcher Certificate of Excellence and the Best Poster Presentation at the conferences like the Epicon 2012 and the CSI 2015. Well, today we will be discussing about the advances in cardiovascular treatment and prevention strategies for heart disease. So, first of all, thank you so much for joining us, Dr. Modi. Could you share some pivotal moments or experiences from your academic and professional journey that have shaped your approach to cardiology and patient care?
Okay, so I come from a family of doctors. My parents are doctors, my wife is a doctor. So the only thing I think we've seen in our house is always medical profession. We've seen how hard it's to work in this profession and what kind of commitments you need to have towards mankind to make it better. So, there was a time when I was about to set my professional and personal goals. I actually made a decision to enter this field, not only to just find a sense of achievement, but also put a very positive impact on the society. So now when we see all our patients coming to us, they come with a concern, they come with disease, they come with some of the other health problems. And I think there are no pivotal moments. It's an everyday experience where it's amazing to see a smile on their face once they're discharging from the hospital, once they are better in their disease, and also once it becomes easier for them to get out of life-threatening situations.
So, what inspired you to specialize in interventional cardiology and structural heart disease? And how do you continue to stay at the forefront of advancements in these areas?
So I think I was always a very curious person. It was my boundless curiosity, scope for medical growth in India in terms of cardiology. And all this led to for me to pursue my dreams. I not only wanted to provide good medical treatment, but also provide the best possible medical technologies in India. And it's very important that, you continue to strive for that imagination, for that medical passion. Only then it is possible that you're able to do this. And with that, you also need your rigorous thinking. You need to become a learner for life. So I think we all in our generations now, and I think it's happening with every generation, all our generations, we need to set standards for healthcare pretty high. Yeah. And once you try and do that, it becomes easier that, you strive to do the best, whatever you want to be, to strive to provide the best medical care possible. If we can get medical care in all national countries, then why not in India? It's everybody's right to get the best possible medical care. And I think that's what drives us around.
Yeah, I was reading about your dedication to humanitarian activities such as organizing cardiology healthcare camps for impoverished communities is commendable. Can you tell us more about your motivation behind these initiatives?
Okay, so we started an organization, an NGO called Save the Heart Foundation. It's about 5-6 years back, just before COVID. And our main motivation behind it was, we need to provide adequate health information to people. Still we do not get proper information. What information people are getting are from various sources which are not accredited, which are not the right sources.
Yeah, there is so much false information all around. The WhatsApp messages and all around that you do this in the morning, you will get the treatment like this. I think there's some false information prevailing in the market.
There is so many false things kids say. If I start naming them, I can spend hours telling you. But people need to understand the right kind of information. And if it comes from a person who's trying to explain you in the right adequate way, in your intellectual way, it becomes. So for me, the first thing was, cardiology for us has never been about treatment. For me, I still feel cardiology is a very preventable disease. It's like any other disease. It's got various risk factors like blood pressure, hypertension, obesity, cholesterol, which once you prevent them, you can control the risk factors. You can prevent the chances of you having a heart disease. You can delay the chances of you having a heart disease. So we need a prevention kind of a role model rather than a curative role model. For me, it's not important that you have an MI, you come to me, you have a heart attack, you come to me, and I save your life. Yes, but what about the next heart attack? How can I prevent the next heart attack? So we started this concept in Save the Heart Foundation, where we wanted people to understand. So we started holding camps where we were telling common people that don't think about other things, just control your risk factors.
Okay.
Then we always obviously give them health benefits, health camps. We also started organizing conferences, CMEs, where we were able to tell the latest innovations which have happened in the last 1 year in cardiology. So we have a conference every year. We talk about just the last 1 year, what has changed, what is the late-breaking trials which have come in, what has changed in cardiology, which is going to tremendously change our view thinking. The doctors, the patients can get more benefit out of it. So I think that's what started. And I've realized that, for research, it's very important, because you need to be in innovation, you need to have discoveries, and you need to have inventions. If you're able to merge all three with your basic knowledge, we can give the best possible treatment to our nation.
So do you think these hospitals play a pivotal role in this? There's a thought prevailing in the market, like if you go to a private hospital you will get a better treatment, or you go to a government hospital you will not get a better treatment. Is this the major outbreak for this?
In India, so I'll just tell you a short story. When I became a doctor and I was really excited, I was like, what, I'm a doctor, I'm going to serve humanity. I joined the hospital and I was actually heartbroken.
Okay.
It was a big dilemma, and it actually intrigued me. Why? Because we were trying to give you the best possible healthcare, but we are so constrained by the limited resources, because the government also has limited resources, and all the funds which were not available. We wanted to do so much for the patient, and there's only so little you can do. And after a while, it's frustrating, because as a doctor, I have a note that I need to do the best and get you out of this situation. But everything in healthcare is expensive. Everything in healthcare is related to technologies which are expensive, obviously. So these frustrations obviously have a huge strain on physicians. Okay, and you're working continuously. You're spending hours and hours in the hospital and trying to do the best care possible. But private hospitals or government hospitals, people need to understand. Doctors do not dislike people. We love you. We love our patients. We're trying to do the best possible we can in our limited circumstances.
But it is basically about the facilities that you get. You get more in the private hospitals because they have more resources.
Yes, I can only work with those limited facilities. If I don't have that facility, I can't provide you with that. So I think that is a lot, and I think we are doing a lot better now. A lot of things have changed. People are now getting better healthcare facilities. Once they start understanding the situation, they will get better healthcare facilities. Obviously, we need to patient health education is more important in India than providing health facilities. We are a big, huge nation of a large population. For us, prevention is far more better than curative medications, because we cannot cure people. If we can prevent diseases, it becomes so easy for us.
Winning prestigious awards like the Young Medical Achiever of the Year and Most Promising Cardiologist of the Year reflects your exceptional contributions to the field. How do you balance your clinical practice, research endeavors, and humanitarian efforts?
I think it's just a passion for the science. You get up and you realize that every day morning getting up gives you the high that today let's do something nice. And I think it's an ever-growing commitment to medicine, which gets crystallized in so many years. And also interest in social issues, shows interest in health education, research. They all play a role together, and you need to believe that you have the ability, that you need to address the health situations of the people. And once, as I said, once the patient becomes better, it's just so gratifying, and it feels so nice if the patient comes back to you the next time and she's smiling. She's like, thank you so much, you did this for me. And then thanks is good enough. You feel whatever efforts you put across, they've gone in the positive direction. So I think if you have the passion for the science, I think it's every profession, if you have the passion for it, if you are able to get up next day morning trying to do something for it, then there's no turning back. Then there's no shortage of time in the world.
So I'm seeing today the heart diseases are very common. There are several cases that a 26-year-old boy died because of heart attack while hitting the gym, or a 20-year-old girl died on the spot due to heart attack because of lifting weights. So are the gym exercises the main cause for it? Main causes of the heart attack?
Nowadays a lot of people are unattended. We need regular health checkups. We've heard famous singers singing on the stage. KK singing on the stage died. Raju Srivastava running on died. We've had so many recently actors who have developed heart disease. Why do we develop heart disease? We need to have regular health checkups. If I do not know what the condition of my heart is, and I try and put excessive pressure on, then it will obviously go bad. So why can't people just get a regular health checkup? We get a regular health checkup for our cars. We get a regular checkup done for our ACs.
For vehicles or everything. We should get for the heart as well, or for the full body checkup.
Full body checkup. So my advice to most of my patients is you across 25, 26, get a health checkup done on your birthday. You'll remember the date, and it's the best birthday gift you can ever give yourself. If you're healthy, you feel nice. Plus, nowadays, because of the social stress, there's a lot of stress in the youngsters, work stress, family stress. Nowadays, social media stress. You want to be popular.
Yeah.
So all those stress plays a large role. Stressful. Known to have these heart problems faster than others.
And I also think the diet, the people are having street food and all. And it is also the main concern for that. For these heart diseases and all.
As much. People come to me and say that, my grandfather used to have so much ghee, nothing happened. I tell the same thing to him. My grandfather was a district surgeon. He used to have ghee every day, but he used to cycle 10 kilometers to reach his hospital. He's not doing anything. We still do not take stairs. We still take a bike or a car to the nearest grocery shop. Why shouldn't we do that? Why can't we all just physically exercise, stop outside food, try and have food as much as you can at home? I think those lifestyle modifications, the smoking has gone up, the alcohol levels have gone up, the tobacco have gone up, and these are all interlinked. The stress leads to tobacco leads to heart disease again goes back to stress and lifestyle. So we need to break it. The vicious circles need to be broken down somewhere.
So lastly, could you reflect on a patient's encounter or experience that has deeply impacted you?
Okay, so this is what happened. So we
anyone case,
Oh yeah, so we're doing a lot of valve replacements nowadays. What we do is a transcatheter valve replacements where we do not allow open heart surgery. So there was this patient about a year back. It came to me and you're like, he had a very valvular disease and he could not walk even to the toilet. Comes to me and it's like, sir, this is what I've heard that you do this. I'm like, yeah. He's like, can we get the valve replacement done? I'm like, fair enough, we'll do that. So you know what, come to this particular date and let's start doing that. He's like, you know what, I have a ticket to Greece. I want to go with my family. One of my grandsons is getting married there. This is the ticket. This is my that's 1 month later. And I want to go. Like, you want to leave after a month? He's like, yeah. He's like, I don't know when you do. I want to be in that wedding after a month.
Yeah.
When they give you such things, it becomes more difficult for you because the responsibility goes up. Anyways, we did the case for him. About 10 days later, he went for the marriage, and he gives me a call from the video call, and he's like, you know what? I have been walking for the last 1.5 kilometers, and I've been dancing at my wedding, and I'm so that video was. Like, he was 87, 88-year-old, and that video was so satisfying. I was like, I can relive that moment of being with his grandson on this wedding. And I think these are the things, which actually help you feel that need in the morning to get up.
It inspires you as well. It inspires you to be in this field and treat more patients.
Yeah, inspires, and then you don't feel tired after such things. Even if one video comes to right, you feel like, I've done something better in life. So I think, it's very fortunate that such people are there to call us back.
Okay. Well, thank you so much, Dr. Ranjan Modi, for joining us. It was deeply an insightful and fruitful session with you. Thank you so much. And I request everyone to subscribe the Power Corridors channel for more content and for more updates. Thank you so much.
Thank you, Asha. Thanks a lot.